To be a navigator, we need to learn about a ship's structure and how to interpret a compass to ensure the safety of the passenger's voyage. Likewise, understanding about clients or patients as individuals is one of the requirements from nursing care. Each patient is a unique individual. They have their own past and present, beliefs and values, mindset, and professional expertise. Nursing care is a holistic aspect and is engaged in a variety of practices, such as respecting patients' decisions, identifying their needs, and showing sympathy while they are facing health related issues or social problems. In order to provide high quality care to patients and improve constantly for a better healthcare system, a person centered care approach should be applied to achieve the positive healthcare's goals. A key principle of person centered care is being able to work with patient beliefs and values. Beliefs and values are an essential part of how individuals see themselves and are instilled with personal meaning and significance. Nurses must perceive and treat each patient as individuals in order to successfully coincide with beliefs and values. Beliefs and values are shaped through life history and can later direct choices made. Medical and personal history provides nurses with enhanced understanding of behavioral and cultural differences between each patient. A greater understanding of different beliefs and values allow nurses to tailor person-centered care specific to each patient. Learning about beliefs and values can also be challenging. Respectful and trusting relationships are built upon understanding patient beliefs and values. Nurses must be sensitive to patient values and beliefs and be careful when responding under stressful clinical situations. For example, it would be poor practice to confuse an old frail patient as sick or handicapped, or address new patients by their first name. Skewed patient impressions can lead to false diagnosis, elementary observations, and practices that are not person-centered. To avoid false prejudices, it is important that nurses continually update and adhere to new patient information and practice specific person-centered processes and data gathering techniques. Shared decision making can be defined as a method where the patient or clients are involved in the decision making process, which therefore includes taking into consideration the patient or client's preferences, showing respect for their choices, and providing realistic, informed options. This concept also includes working with the patient or client's beliefs and religious values and creating a realistic baseline for the decision-making process. Person-centered decision-making can be described as the center of the knowledge and experience an individual can apply to the care process, which can assist in the treatment process. It aims to change past experiences and therefore allow them to reflect on the various perspectives, which can then assist in forming perceptions and understandings. For the health practitioner, it is crucial that they are there offering support and practical knowledge while allowing the patient or client to be following their own path. Therefore, one of the most important aspects of this framework is successful methods of communication, which includes active listening. There are various challenges that can be present when applying the shared decision-making concept, and they include ability to understand medical information, family dynamics, cultural and religious differences, language barriers, lack of time with health professionals, and also not being able to come to an agreement with a health professional. However, from research, it has been noted that the biggest challenge with the shared decision-making method is the inability of the patients to feel confident enough to participate or choose an option, as well as finding difficulty showing their preferences. It was shown that many of the patients or clients found themselves forming a barrier between the health practitioner and themselves in terms of medical knowledge. In a research study carried out by the Health Foundation, it was illustrated that patients or clients felt that they do not have the sufficient knowledge and would just like to be told in what to do about the treatment. As mentioned before, communication is a vital key in the shared decision-making framework. And without the communication and participation from the patients or clients, it would not successfully fulfill the attributes of this concept.
Authentically is the connectedness of the practitioner with the patient and others significant to them, determined by the knowledge of the person, clarity of the beliefs and values, knowledge of self and professional expertise. This definition was provided by Brennan McCormack and Tanya McCants in their text, Person-Centered Nursing, Theory and Practice 2010. The effectiveness of the practitioner to engage with and connect with the patient depends on the practitioner's abilities such as the patient knowledge, clarity of their beliefs and values, knowledge of self and professional expertise. Full engagement is present when a patient and nurse are connected in a relationship that has care, partnership, and collaboration. Decision-making and values are known at an unconscious level in giving and receiving care, and the nurse is aware of the political, environmental, and cultural pressures and integrates them into their practice. Partial engagement is when the nurse assesses the situation but formulates a problem that causes the interconnected working between the patient and the nurse to be disrupted. This causes the relationship to be altered, and the nurse may lose the grasp they had on the patient. During this period of time, complete disengagement occurs where the nurse needs to decide the appropriate action to reconnect the relationship, then work. Sadly, the emotional labour of nursing isn't seen as important as the real work or more clinical side of nursing. However, the importance of the emotional labour to well-being and person-centred care must be recognised and acknowledged. Being sympathetically present shows the understanding and accepting of personal uniqueness and values as an individual. Sympathy is not equal to empathy. It is classified sympathetic care is different from empathy since we cannot completely understand the other's particular experience. Bereavement is a notable instance. We cannot fully understand how a person feels after bereavement. Person-centered care is not only interacting with a patient. This can deliver when health professionals are providing all kinds of clinical interventions on a patient, such as administering medication and recording vital signs. These strategies to ensure sympathy are presenting in the clinical practice. Firstly, understand the values and beliefs of the patient as well as their loved ones by being active listening, non-judgmental and open and honest, collaborative and supportive. Emotional management is a way to establish sympathetic care to the patient as well as their loved ones into the nursing practice. There is including superficial engagement, reflective engagement, and authentic engagement. According to Tanya McCants, holistic care is the provision of treatment and care that pays attention to the whole person through the integration of physiological, psychological, social-cultural, developmental, and spiritual dimensions of persons. The aim of holistic assessment is to gain the most information necessary without finding irrelevant information. A person may present to a nurse with similar medical or social problems, but only by conducting a thorough and systematic assessment, including the factors mentioned above, as a truly individualized plan of care to be developed. The key to providing holistic nursing care is not about how long you spend with a patient, but how you use that time you had with them. Learn the patient's name and use it. Make strong eye contact. Show that you care. Preserve their dignity. Educate in the importance of self-care, and simply asking if the patients have specific cultural or religious requirements or benefits and accepting these into the plan of care are all ways of promoting a healthy psychological, emotional, and spiritual environment, a holistic care environment.
Patient-centered care is the approach that is used in the healthcare system with the engagement of not only healthcare professionals but also patients themselves with the purpose for the optimal health outcomes as an active partner. It is expected that patients will then obtain the capability to manage their health more effectively and give a basic understanding about their personal health issues. It brings benefits in many aspects, such as patients' self-efficiency in recognizing the events happen relating to their health problems is built and promoted. Disease management will then be in patients' control. The communication between healthcare professionals, the doctors, nurses, social workers, physiotherapists, and patients can also be developed, and it can help establish a better relationship. All of these factors can contribute to achieve the treatment goals by participants. To prove for this valuable process, there was a statistical analysis which indicated the effective result after having applied patient-centered care processes in Gothenburg, Sweden, on 177 patients admitted to coronary care units for acute coronary syndrome, with other participants including physicians, cardiologists, and registered nurses. These comparisons were divided into two groups, control group and person-centered care intervention group, and proceeded in 6 months. Patients were shared with all medical referrals, care plans, and discharge notes by collaborative healthcare professionals. In the meanwhile, patients would be proactive in identifying all their symptoms. The control group's participants were managed by using guideline-based care procedures. The gap between follow-up visits were far, about 2 to 3 weeks after patients being discharged, and another visit after 8 to 10 weeks when patients' health status were medically stable. However, all medical referrals and discharge plans were not shared with patients. Whereas in the person-centered care group, all participants were encouraged to actively take part in to achieve the optimal goals. Furthermore, after having been discharged to home, patients would be arranged for 2 follow-up visits by a cardiologist and the RN after the first 4-week discharge, then by a physician and an RN in another 4 weeks. Each follow-up visit included a discussion and revise session in the second visit about a PCC plan. The result proved that the patients underwent PCC group gained confidence in controlling their symptoms in contrast to whom in the control group regarding the improvements in lifestyle behaviors, self-management in the physical activity and stress, and the quality of life had been improved then. Person-centered framework is not only an unrealistic theory which the person-centered practice is really happening in the real world but applied in many healthcare centers, especially for the dementia patients. Dementia can cause people forgetful, limited in social skills, personality changes, and sometimes affected to their verbal communication. Based on those dementia symptoms, health practitioners should establish a unique care plan practice to satisfy different patients' needs, which person-centered care practice can be helpful during the care process. According to Yem, person-centered care practice helps the patients with dementia to have more choice and control in their lives. That means that person-centered care practice can support the people with dementia to live well by a series of personalization. Patient-centered care is a useful approach and a highly demanding of the collaboration between healthcare professionals and patients for being able to achieve the optimal health outcomes. Healthcare workers, especially nurses, accept patient health problems as well as apply person-centered care processes as a tool to identify patients-related social and psychological aspects in a one way or another which can affect their health outcomes by recognizing individuals' values and beliefs, sharing their compassion and sympathy, respecting their decision-making, educating and interpreting their health concerns, and assisting them to be more independently on taking care for themselves.